In 2015, the Philippines began a large-scale dengue fever vaccination program after a rise in cases of the mosquito-borne disease. But in November last year, the French company Sanofi, which makes the vaccine called Dengue, said it posed a risk to people who had not previously been exposed to dengue fever. After that, concerns began to spread among the public.
At first I was afraid because 4 of my children had already got the vaccine from the health center.
Other countries adapted to Sanofi's announcement by updating guidelines and labeling. But in the Philippines, public concern turned to outrage, fueled, say the report authors, by a highly politicized response from the government.
This was an opportunity to jump on the previous government for all the wrongdoings. Why did you get this vaccine? And it became an uproar and created not only quite a crisis around this vaccine, but it bled into other areas of public confidence in vaccines more broadly.
The researchers picked up the fall in confidence through their ongoing global survey of public trust in vaccines. In 2015, 93% of Filipino respondents strongly agreed that vaccines were important. This year, that figure has fallen to just 32%, while only 1 in 5 people believe vaccines are safe.
This dramatic drop in confidence is a real concern about risks to other diseases, such as measles, on the one hand. On the other hand, too, Asia is ripe for a pandemic and influenza viruses to take hold, and in the case of a pandemic or an emergency outbreak, that's not a time when you can build trust.
Larson says misinformation played a big part in undermining confidence.
The role of social media in amplifying those concerns, in amplifying the perception of risk and fears and their public health consequences is dramatic. It's really dramatic.
Immunization programs are being tested to tackle some of the world's deadliest diseases, like malaria. Meanwhile, containing the outbreak of any future pandemic, such as influenza, would likely rely on emergency vaccinations. The report's authors say it's vital that governments and global institutions do more to build public trust in vaccines. Henry Ridgwell for VOA News, London.